So welcome, everyone. Thank you for joining us for How to Talk About Vaccines and Find Common Ground. This session is part of the Morgridge Institute for Research's Fearless Science Seminar Series. Today is March 31st, 2021. My name is Gabriela Gerhardt. I work for the Morgridge Institute for Research, and I will be moderating the session today. The Morgridge Institute is an independent biomedical institute in Madison, Wisconsin. We work in partnership with the University of Wisconsin-Madison. And our scientists recognize that a fundamental understanding of human biology will drive the next big advances in human health. Virology research is one of the focus areas of the Morgridge Institute. And another interest is sparking scientific curiosity in the public. And we have a vibrant science outreach team that runs programming like Saturday Science events, the Stem Cell Summer Science Camp for high school students, and Crossroads of Ideas lectures. Communicating science is a challenge, and the world has been digesting much more science news since the onset of the pandemic. Many of us have had to learn how to communicate scientific and public health concepts in our personal lives. And this session today is intended to help you talk about COVID-19 vaccines with the people in your life. Vaccines are available, and while they may be difficult to get at the moment, although it looks like we have quite a few people that have been able to get vaccinated, which is fantastic, they will be widely accessible in the near future. And as we all know, some individuals are on the fence about getting their shot, and approaching a conversation about vaccines can be very challenging. But we do know that those one-on-one personal conversations are an important part of the public health effort to get us to herd immunity. And so today we hope to give you some insight into why there is hesitancy, how you can navigate these conversations, and some insight into what you might say. We will also share some resources via links and PDFs so you can do more research on your own, and these will be shared through the chat feature on the right side of your screen. And please note today that while we do have a public health expert with us, none of us are medical doctors, and you should always consult your doctor for specific recommendations related to your health and medical decisions. We will jump right into a panel discussion with our experts, and we plan to wrap up around 5:30 p.m. The first of our three panelists is Dominique Broussard. Dr. Broussard is a professor and the chair of Life Sciences Communication at the University of Wisconsin-Madison and an affiliate of the Morgridge Institute for Research. Broussard is an internationally known expert in public opinion dynamics related to controversial scientific issues. She's particularly interested in understanding the role of values in shaping public attitudes. She serves on the executive committee of the Societal Experts Action Network with the National Academy of Sciences, Engineering, and Medicine, which aims at facilitating rapid and actionable science-based responses to social and behavioral-related COVID-19 questions. Welcome, Dominique. Also joining us is Ajay Sethi. Dr. Sethi is an associate professor of population health sciences at the University of Wisconsin-Madison. His research interests lie broadly in the study of infectious diseases, including HIV, healthcare-associated infections, and now COVID-19. He regularly teaches a conspiracies and public health course at UW, which focuses on how to have conversations with people whose views on health-related topics may be different than yours. He is also a recipient of the 2021 Chancellor's Distinguished Teaching Award. Welcome, Ajay. Also joining us is Tess Ellens. Tess is a public health nurse and immunization coordinator with Public Health Madison and Dane County, and has been on the front lines of the pandemic since its onset, including playing a key role as the COVID vaccine deputy for PHMDC with vaccine rollout in Dane County. Her career experience has revolved around dedication for advancing health equity and serving the underserved. Welcome, Tess. So we'll go ahead and get started with the conversation. And let's start with Ajay. What is vaccine hesitancy? And in a general sense, why are certain individuals concerned about getting this vaccine?
Thanks for the question. Vaccine hesitancy is sort of a reluctance and maybe refusal, but often it's a reluctance to accept a vaccination despite it being available to you. And so when you have hesitancy, it can cause people to essentially have a delay in getting vaccinated. And the reasons are going to be pretty wide ranging. Sometimes they're associated with not having full confidence in a given vaccine, or maybe just having some complacency about it. And sometimes it's unrelated to attitudes. It might be related to logistics. It may not be convenient to get vaccinated. And so that's what ends up causing the delay.
And are these concerns about the COVID-19 vaccine in particular different than concerns in general? Like what's different about this particular instance?
Yeah, I mean, there is some overlap, certainly. So if somebody has a tendency for hesitancy towards vaccination before COVID, they may continue that sort of attitude now. But during the pandemic, where there's been a year of a lot of uncertainty, a lot of stress and anxiety, uh, it has an ability to potentially impair sort of our judgment, our decision making towards something like vaccination. And some people feel that, the vaccines came about rather quickly. And that also gives them some reluctance towards getting vaccinations. So for those reasons, we're in a little bit of uncharted territory. We've never been in this situation before and never had a vaccine developed rather quickly.
And so, Tess, you've been a public health nurse since before the onset of the pandemic. Do you see this as a related issue that's been going on for a long time? Or do you think that this is a unique issue to the COVID-19 vaccine?
In public health, we always kind of are fighting the uphill battle of vaccine hesitancy, but this has definitely provided some new challenges in the sense of the speed at which the vaccine came out does, increase some concerns about how the vaccine. So we've been doing our best at public health and working closely with our partners here in Dane County to try and address some of those concerns that are really specific to COVID vaccine. It's also a brand new type of vaccine, which kind of adds on to some of that hesitancy too. So all of these things compounded does make for a unique scenario in terms of vaccine hesitancy.
Great. And we will get into some specific answers about the COVID-19 vaccine in particular a little bit later, but we'll start the conversation more broadly. I do want to comment on briefly about the use of certain labels related to how people feel about vaccines. Like you'll hear anti-vaxxer, vaccine hesitant is a term you hear right now. And Dominique, could you comment on the use of those labels? Are those labels useful? Or are they damaging to the conversation?
Well, I think it depends who we're talking about. I guess for some people that communicate about this issue, it's much easier to actually have a reductionist approach. So putting people into boxes and just assuming that everybody fits one size or all, it makes it much easier to tell a very complicated story. However, the reality is that story does not match, what's happening in the United States. When you talk about hesitancy or even like any type of attitude towards science, you have a wide range of spectrum of attitude. So as far as like anti-vax people, this is an extremely small number of the American population. The same as when we talk about denials of science, or the same about any type of broad statement about anything that relates to human psychology, tend to actually make things that are very complicated look very simple. So I would say that, even the term hesitancy is, I think, used right now, and Jay actually mentioned that when we're talking about this panel, is used right now to refer to different type of people. Some people are just waiting and see, they're hesitant. Other people are actually, hesitant because they don't have the current transportation to go, and so on. So even the term hesitancy refers to different type of reasons why. So I think it's a better term than anti-vaccination, but there's no completely, accurate term because we talk about very different type of attitudes.
So Dominique, if you're approaching a conversation about the vaccine, what are the first steps? What are the first steps that you would take? And I know we called the session "How to Talk About Vaccines," but I think maybe listening is the better first step. So could you give us some insight?
Yeah, that's right. And actually, like the first asking people, have you been vaccinated? Even that question is actually kind of private question. Why do I have the right to ask person if they've done something that at the end of the day is not my business, right? So I think, you could start talking about COVID-19, hoping that their family hasn't been, impacted. And if the family has been impacted, empathize with the problems. And, and the conversation can potentially naturally go toward vaccination. But I think anything that, that actually may be potentially unclear in people's mind needs to be approached with tact and respect and empathy, and certainly with no judgment.
Ajay, do you think that you have something to say about approaching these conversations and, making the decision to even have that type of conversation? Is it always right to broach the topic?
Yeah, I think that's important. we should not always put ourselves in a position where we're approaching somebody else about encouraging vaccination. People have autonomy, they deserve their autonomy, and you should ask yourself, I think, before approaching someone, why are you initiating that conversation? Do you have a trustful relationship with that person? And I can certainly think of people in my life who know how to push my buttons. I know how to push their buttons, and I don't want to put myself in a situation where a conversation might escalate. And so I think there's sort of like a pre-conversation checklist that's not a bad idea to do, just to make sure your emotions are in check. Ask yourself, why are you approaching this person? And then, if you have the right conditions, you do exactly what Dominique was talking about. Is to share a conversation and understanding of each other before they're diving into decision making. I think it's important to just it's kind of golden rule 101 type things to think about having a conversation.
Yeah, and I think we also should make the point too that, Tess, in your day-to-day, you answer a lot of questions, or people that are at the public health department answer a lot of questions. So if people have specific concerns, there are resources that they can reach out to, even make a call and ask a specific question. Is that correct?
Yeah, definitely. So, there's a ton of resources out there, and it's kind of hard to wade through all of the different websites and pieces of information out there. So we try and kind of bring all on our Public Health Madison Dane County website, but also, CDC, Mayo Clinic, also great resources that you can use to try and sift through some of that information, because it can be really overwhelming. And, even when people come through here at Alliant Energy Center to get their vaccine, they already have scheduled an appointment and they still have questions. So we're happy to chat through those questions, because we want to make sure that people are feeling comfortable and fully on board for something that is a big deal. I always say that every vaccine, is a big decision to be made for protecting your health and the health of others. But, there's a lot of pieces that go into that.
So I was hoping that we could comment on, let's define the word empathy and maybe talk about how empathy is an important part of having these conversations. So perhaps Dominique could speak to that first.
Well, I think it really depends on the situation we are talking, about. Like, what's hard about this issue is it's a complicated issue, and we try to give solutions and magic potions to something that really depends so much on who we're talking to, in which context, and for what outcome, and so on. But so I'm going to give a specific example of, like, myself, let's say, talking to my friend who's a public school teacher that is frustrated because I already got one dose of the vaccine because I'm asthmatic, and she has not yet. I'm not talking about Wisconsin. So this situation, I empathize. It's not fair. I think she does deserve to have the vaccine as much as I. So the idea is really to actually knowing where we are coming from and our privilege. In that case, I am privileged to have it because of a medical condition that, I didn't do anything particular to have that, versus her position of being in a context where she will be at risk. So I think empathy is really that idea that we can put ourselves in people's shoes to the extent that it's possible, right? Obviously, we cannot put ourselves in people's life, but and understanding that in the conversation, we may feel like we're there to listen, but we come in with the notion of privilege, in that case, my asthma condition, that other people might think, it's actually you are too lucky. Why is that fair? So is that I think the empathy, level has to be justified with that idea of fairness. And what's fair, what's not fair, where does it come from, and so on. So I'm giving you a circumvented answer here to say that I think we should not always conclude that empathy, equity, fairness always means the same thing. It depends who's talking to whom in which context.
Tess, I guess I'll go back to, we touched on this already, but right now, a lot of people are talking about their personal healthcare decisions more than is typical, asking people about vaccines. And so are there medical reasons that somebody might not be able to get the vaccine at all? Not a choice, but an absolute necessity one way or another.
Yeah, definitely. So there are certain allergies that people might have that make it a complete contraindication for them receiving the vaccine. So, things like a polysorbate allergy, a PEG allergy, those sorts of things are true medical reasons why somebody should not receive the vaccine. And whenever we talk about vaccines, the reason why we try and get to a place of, herd immunity, that's a term that's thrown around a lot, is because not everyone can get the vaccine. And, trying to think of vaccines always and herd immunity as we, not me, because we do have ones in our community that for whatever reason can't get vaccinated. So trying to think of that, when we're talking to others too, that when we do ask, the question, have you gotten vaccinated or not? There may be, you're kind of delving into different medical history that somebody might not be willing to share.
Yeah, one of the registrants specifically shared an instance of somebody that would theoretically love to get a vaccine, but is unable to. And right now there's maybe a little bit more judgment around vaccines than is typical. So it's something to keep in mind. And it's one of the reasons why bringing empathy and trying to put yourself in someone else's shoes is valuable with these conversations. So going back to how to navigate these conversations, if you're going to have one of these conversations, if you are currently having one, you jumped into it, what are some of the important considerations to how you approach these conversations? What are the things that you should be keeping in mind as you navigate it? And could Ajay, could you comment first?
Sure. Yeah, I think first thing is to put on your listening hat and do a lot more listening than talking. Because if you really want to come to an understanding of what is causing a reluctance, you've got to listen. And if you're not sure what somebody's saying, ask more questions. And along the way, maybe even think, you can validate somebody's frustrations. Even if you don't understand sort of why they feel the way they do, certainly you can feel that they're frustrated, and just acknowledging that, can build trust. And that's really important. I think it just starts with really listening and also not having a goal of a person saying, I'm going to get vaccinated as the outcome of that conversation. You just want to advance the conversation so that maybe you can talk again at another point in time, and to continue to advance, that encouragement.
So I think one of the ways to summarize that is kind of meet people where they are. Is that a good, yeah.
Yeah, and to think of it as how would you want somebody to talk to you if you were in that position? Would you want it to feel like you're buying a car and feeling pressure to sign a dotted line? Probably not. You probably want your autonomy and sort of your ability to think about how to navigate that. Really, I think we can put ourselves in the other person's shoes if we replace the context of vaccine decision making with things like car purchase or buying a house or other things in our lives that sometimes we don't want to feel pressure about.
So Tess, you have a lot of these conversations with individuals. Would you say that, I imagine that those conversations don't always go the way you might expect. Could you share a little bit about what it's like to constantly have those conversations about vaccination?
Yeah, definitely. So I think it piggybacks really nicely off kind of what we've just been talking about, in the sense that I always consider my job as never convincing, because I think that gets right into that I need to win, or I need to, win this person over mindset. And that's not my job, right? These are all very personal decisions of someone to get a vaccine. So when I have these conversations, I really try and go in with, tell me more. Tell me more about your experiences. Tell me more about, your perspective. And it is always really enlightening to me to hear what people have to say. And again, I'm just one person. I know that I come from a privileged background. And so it's really easy for me to be really connected to science and data and good information, but not everybody has those privileges. So try really hard to, again, be listening. And I consider my job giving people the information to make an informed decision themselves, right? And good, reliable information, and just directing them to the right place and getting them connected. And it definitely does not always go, the way that I plan. And some people leave without receiving a vaccine, and that's okay, because that's information that they can chew on, they can think about, they can talk with others in their life about, to hopefully make a decision that's right for them and for their family and loved ones.
That's very good advice. So Dominique, I know that the National Academy of Sciences has put out some guidance about how to have these conversations. Mm-hmm. Since the one-on-one conversations, someone might not call the public health department, but maybe they're going to have a conversation with their neighbor or with their friend. So they put out some guidance about how to have these conversations. Are there elements of that you thought we should perhaps highlight?
Well, something that we should highlight, I think, before we go more into detail about all these, is that the vast majority of Americans wants to get vaccinated. We have 36% of Americans that already were at least already had one shot. You add to those the ones that will get the shot as soon as they can. You're close to 70%. So talking about, it's not only talking to the hesitant, it's also talking to those that have to wait because they have no choice and then no vaccine in the area. So it's not always only one side of the coin. Is also the other one's like, look, it's going to come to you, do not worry. So I think we need to remember that. As far as those that do not want to get vaccinated, I think the group that it's interesting potentially for us to think about is those that say they want to wait. And I think it's close to 15%. They wait and see. And, this is a human way to deal with new things that are unexpected, for which we don't have a lot of data and personal experience to deal with. We wait and see, and we're going to see what are the results on others. So that 15%, I think, are the interesting one. They're the people that I think that the potential are side effects. So they're waiting to see if their neighbors, their family, and so on have side effects and so on. So when we're thinking of addressing that, is number one, not assuming we know where people stand, where we go. And I'm repeating what Tess and Ajay was saying. And don't try to persuade everyone. Some people, it's not even worth trying to persuade them. And it's fine. People are entitled to the decision, right? That's nothing we can do. But for the other ones, I think the room number one is going back to everything that was said before, is knowing where people are coming from, and most importantly, avoid repeating false claims, because we've seen things such as no side effect for the vaccine. Well, that's not true. There is a slight numbers of side effects. 3% of the vast number of people that were vaccinated had some side effect. Let's recognize the fact. Let's be truthful about the fact. And also let's recognize uncertainty. The more people vaccinated and so on, the more we will know about the vaccine. And actually it seems good. The more we have people vaccinated, the more we see that the vaccine is effective, right? The vaccines. So the idea is number one, avoid repeating truths, because the truth develop as this pandemic develops, and let me sure we know where we're talking from. And number two, really know where people are coming from. I think those are the two key things that would tell people to keep in mind when engaging in those conversations.
So I think a lot of the questions submitted by the registrants in advance of this were about how to answer certain questions about the medical questions. And those are some of those people that might just not know the answer, and maybe they'd change their mind if they had the right answer. So I was hoping to kind of throw a few out to Tess, and hoping that she could give some answers from a public health perspective. And once again, want to emphasize that none of us are medical doctors, and make sure that you keep that in mind. But this is coming from immunization coordinator from Public Health Madison-Dane County. So are the vaccines safe?
Yes. Short answer, yes. They have been extensively studied. A lot of great minds have gone into this. So they are definitely safe. Clinical trials are very, very involved, involve a lot of people to make sure that nothing is ever put out before it is unsafe. The thing that I always like to frame the conversation around too is vaccines are very different than most medications, in that we are giving something to a healthy person. That means the risk for the safety risk is much, much smaller. We don't want people to, have mistrust in something that we're giving to healthy people. So yes, short answer, vaccine is very safe.
Fantastic. And we will start sharing some links in the chat for you to find some more information, but we'll kind of walk through some of these questions. So some people are concerned about the speed that the vaccine was brought to the public. And is it okay that it was developed so fast? Has it had enough testing?
Another short answer, yes, I'll elaborate definitely. But I think, just acknowledging that the name of the program for developing COVID vaccine was called Operation Warp Speed. And I think just kind of acknowledging that, I think that created a lot of fear in folks with how fast this was being developed. The thing that was, novel and new about it, and the reason why it was able to happen this way, is it was times that there has been a collaboration of science around the world. And that is why we were able to develop this so fast. We were able to recognize as a globe that this was, a threat to our well-being, and we're able to work together really collaboratively to make this happen so quickly. The other thing too, in terms of how fast it happened, usually with, vaccine clinical trials, they're spread out over time. A lot of small adjustments are made at the beginning. We do clinical trial, phase 1, phase 2. In this way, there was a lot of communication between science that was happening in real time as we were learning about the coronavirus, and the clinical trials that were happening simultaneously. So that was really unique in this development of this vaccine too, in the sense that scientists and researchers, as well as those in the clinical trials, were constantly communicating to just improve the vaccine as it went along, which is unique. And I'm hoping and think that it will really shape how we develop vaccines in the future.
Fantastic. Oh, I do want to, there's an interesting message in the chat that's saying that there is, the American Society for Virology is hosting some town halls. There's a link to register for that. So that's another potential resource to get some information. So another question, some people are afraid of the vaccine because they've heard of side effects. And I was wondering if you could comment on that.
So side effects are a completely expected and normal part of receiving any vaccine. So some vaccines have more side effects, some vaccines have less side effects, but side effects are just our body's way of showing that we're mounting an appropriate response to the thing that we've introduced it to. So when we do have side effects, they're normal, expected, and temporary, and risk versus benefit. Having side effects for a few days so that you're protected long term from something that can be really dangerous is much, much better, than actually getting coronavirus and becoming ill or possibly worse.
Fantastic. And yeah, I think that's the one thing that it kind of emphasizing the need to be honest in order to build trust in these conversations. We don't want to convince somebody by telling them that side effects don't exist. To reduce their fear, we need to be honest with people as we move forward with it. People have questions about the long-term effects of the vaccine, and they're concerned about what that. How do you respond to that when you get that question, Tess?
So this is a great part of balancing honesty and unknowns, and talking about the long-term effects of the vaccine, long-term efficacy of the vaccine is one of those unknowns, and something that we tell people honestly. As we continue to vaccinate more and more people, as we get further along in this vaccine response, we're learning more and about how long the efficacy is. But at this point, we're not really quite sure. However, that doesn't mean that you shouldn't still get the vaccine. I always like to equate it to the flu vaccine. We get flu vaccine every year, even if the efficacy isn't as long. That doesn't mean that it's not as important. So not saying that we'll need to get COVID vaccine every year, but just in the sense that we have a lot of different types of vaccines with different long-term efficacy, but they're all still very important in keeping us safe and healthy.
Great. And one other common question I think you get is about the mRNA vaccines, considering that they're a new class. And I think one thing that people are concerned about is how that affects your body, if it changes your DNA. What's the answer to that one?
No, another short answer. No, it does not, affect your DNA. The way that I like to explain mRNA vaccines is simply being a messenger and hand delivering instructions to your immune response. And just, explaining it that way, that it's just handing over these instructions about how to fight the coronavirus vaccine. And then it, breaks down pretty rapidly once it hands off those instructions. So cannot alter your DNA, completely safe.
Great. So we've shared in the files tab by the chat, there should be a tab for files. We've shared some FAQs and fact sheets that you can download from Public Health Matters in Dane County. And we'll also start sharing some links to the Mayo Clinic answers, the Johns Hopkins answers about vaccine, because there may be more little things that you'd want to know if you're having a conversation. There's some good resources out there. So I think we should move on to some other types of concerns that are not medical related. And I think one of the ones that some of the questions came in about was mistrust of healthcare due to medical racism. And so the question is, how do we build trust with Black community, Indigenous peoples, others that might have experienced medical racism or, knowledge of a history of breaches of trust with the medical community? How do we go about addressing that?
I can maybe start, and I'll say there's sort of two things I think that are important. One is to apologize, on behalf of sort of the medical public health establishment for past atrocities that have occurred. And I think the other thing to remember is that despite that history, not everybody is holding on to that history in thinking about whether they want to get vaccine or not. That we shouldn't use that as an excuse to sort of not have conversations with people about getting vaccinated. And when you probe, you might find out that that structural racism and racism in healthcare is something that's been longstanding, but it's not like something that's going to prevent someone from getting vaccinated. And to really dig deeper to find out sort of what are those issues that somebody's thinking about and to address those.
I can jump in as well. Going back, I like numbers. So another poll here, among the 30% of people that are hesitant in the United States, 40%, more than 40% said actually that they are concerned about past mistake of the medical community. And so building on what AJ was saying, it's recognizing that. So that means that there have been those mistakes. But the mistakes in the past help us actually make the future better. And that all of us involved in COVID-19 related communication, public health, and so on, we want a better future. That's why all the four of us are here, and the 200 attendants are here, right? We all together want to build a better community, a better post-pandemic world, and so on. So we can go forward by making sure that those that potentially are still perpetuating these mistakes know that we're watching. All of us have a responsibility if we see that there are still structural racism in a hospital, in a doctor's office, and so on, to report them, to make them known that we are not going to actually make these kind of things acceptable. It's not the society we want to live in. We not only together, we recognize there have been mistakes, and we're going to all work together for the future to be better. So this being said, it means that we need to recognize that fear is normal. If you're in an oppressed, marginalized community where that there's been oppression, obviously, we understand where you're coming from, but I think you need to also remember that allies are there to actually make sure we move forward in a productive way.
Just to piggyback off of what both of what they said is, I think it's really important, just to name it. Working for public health, I'm acutely aware that public health was part of the Tuskegee, experiment, and owning that in the sense of we can, understand why there is fear. Not that I can understand from a place of privilege, in different ways, maybe that are more intentional, so that we can start to do more listening, so that we can understand where some of the concerns and fears are, before, again, just jumping in and vaccinating. Maybe there's a little bit more conversation and listening that needs to happen first.
And is it true that sometimes maybe you're not the right messenger? Maybe you need to direct somebody to somebody else or some other resource, because who the information comes from might be more important than the information itself?
I 100% agree with that. Again, I fully recognize that I'm a white woman from public health, and that does not jive real well with some folks, who might just not receive that information well because of past experiences. And so working really hard to have people that reflect the communities that we serve, having those conversations so that it's not me coming from a different place that maybe can't relate. That it's more real conversation.
So one thing that I came up a lot in the questions that were submitted in advance of this were about political views and differing political views, how that has played into people's choice or thoughts about getting vaccinated. And one of the questions that I thought was effective said, political tribalism appears to be one of the factors to vaccine acceptance. How can people from one side of that spectrum build confidence and trust with somebody with differing political views? And so, Ajay, could you comment first on that?
Yeah, sure. I think the tribalism predates the COVID pandemic. That's been a growing problem over the years for a while now. And so it's not a manifestation of COVID, but it certainly sort of synergizes with the stress everybody has had with COVID. So having conversations, I think finding shared interests might be a good place to start. And nobody, I think, wants to see deaths due to COVID in our community to a point where our healthcare systems are burdened, that they occur among our friends and family. I think people want to avoid that. And maybe finding some shared values and interests might be a good place to start the conversation. I'll also say, though, that politics can sometimes be one of those hot button topics. Some people like a good debate and others want to avoid it. And I think you can also maybe rely on, in our surveys that people are conducting, showing that, acceptance of the vaccination is associated with political party of affiliation. What people say in surveys may not necessarily align with what they choose to do in private. And we see that sometimes with voting behavior, for example, and what you might report in a poll. And at the end of the day, there's lots of consistent data out there to show that people will get vaccinated if their healthcare provider recommends it to them. In the privacy of that doctor-patient relationship, you might find that we have more vaccination than surveys may lead us to believe. And so being optimistic about that, I think, is important. But when we have those conversations, start with that shared interest.
Yeah, Dominique. Oh, go ahead. Sorry.
No, I just want to jump in on that. And, also talking about, the polls, let's remember that we are close to 15% point more, of people that wanted to be vaccinated now compared to September. And so that means that includes Democrats and Republicans. So I think also always pointing to polarization in America increases polarization in America. I think we have way more things in common, all of us, than just the political party, and that we can talk about a lot of things and our kids and so on, but the value of our community, the well-being of our businesses and so on. And so I truly believe that we can find common ground, as Ajay and Tess were saying, and just not talk about political tribalism.
There is kind of an undercurrent that happens sometimes about, distrust, a fundamental distrust of government, distrust of scientists, distrust of corporations with a profit motive. And that is leading to some misinformation out there about the vaccines and how they were developed and how the rollout is happening. And there were a lot of specific questions about specific pieces of misinformation that people have encountered. And so I guess in general, how do you go about countering that type of misinformation? And, if you see it happening, what would you recommend somebody choose to do about that?
I know for me, when I'm having conversations with folks here on the ground, I always like to ask, where did you hear that information from? I feel like a lot of times I can hear that it's either traced back to social media or a story that they heard from somebody. So trying to kind of connect them, how do you usually make your healthcare decisions, right? Is it usually through social media, usually your friends and family, kind of like Ajay said earlier, usually it's in a really close relationship with your provider. And so trying to leverage those partnerships and, relationships that people have with their existing providers, I think is really important, because I think, relying on social media, I kind of ask folks sometimes, in my personal circle, would you rely on social media for a diagnosis on anything? Probably not. But would you trust your healthcare provider? Most definitely. And, then it doesn't kind of get into the whole, well, which website did you use, things like that, because there is an overwhelming amount of information out there, and it can be really difficult to wade through. So just connecting people, that person to person relationship, I think is really, really helpful.
I guess another question that comes up too is, are there situations where you maybe shouldn't have a conversation? You might choose just to not respond. There are some people that have laid out some pretty difficult situations in the questions. Ajay, could you comment on that?
Yeah, I mean, I'm someone who, maybe I'm being personal, but I'll say if I sense that my blood pressure might increase after having a conversation, I'm not sure if that conversation is worth having. I think self-improvement is part of this process to having a conversation. Being able to check your ego, to really be truly altruistic when you're having a conversation, to just sort of think about sort of being mindful or being in a position to supporting someone, to working through the issues that they have, and not just for one conversation, but to build a relationship or to continue a relationship over a period of time. You have to be up for that. And so I would say, if you're not up to the task, work on yourself first, and then maybe think about reapproaching someone. And of course, all relationships are different, and they're all unique in their own way. I might approach person X one way. I may not even want to approach person Y. I may, want them to come to me first. And just being self-aware of how you sort of engage in conversations in general, I think are really important, and to improve yourself before having them.
So these tough conversations, they're really a skill that you have to build in order to be able to have them properly. Are there particular concepts that people can research to learn more about how to have those conversations?
I in my class, we rely on principles of motivational interviewing, crisis counseling, in which, listening and validation are real tenets. Mindfulness as well are important sort of things to think about. And really, it really does come down to just having respect and listening.
And going back to shared values too. I mean, I think that's something that we can fundamentally agree on, that bring it back to basics. I know that's something that you focus on in your research, Dominique, is that right?
Yes, that's so right. I think that's really something that's key here as we think of those difficult conversations. But going back to the issue of misinformation, what we need to keep in mind is that Americans at large want to actually have the right information in hand. So they may come across some piece of information, but like at the end of the day, they want to have the right one. They want to actually have the correct fact or the correct statement. They may tend to, and we all do that, we may tend to discard, information that doesn't fit our values, and tend to actually believe information that fits our values. But if we have somebody else that actually we respect, that has the authority to actually discern among all those pieces of information, we're going to believe them. So that's why, like I see, for example, in Facebook, I have my professor hat, expert of National Academy of Science hat. I had several people post stuff, and I would say, well, actually, if you look at this report of the National Academy, I think this information is equal. They say, oh, sorry, I'm glad you said it. So it's not that always people want to push misinformation for the pleasure. The vast majority of people, they would like to actually know the correct information. So I think when we talk to people, we need to also think about the hat we have on. Is it our annoying uncle that we always, fight about with at the Thanksgiving table? So then that may be not worth it. But if it's somebody that trusts us in our expertise, and in Tess or Ajay, right, then it's very different. And then we can engage in very different ways. But at the end of the day, most people want to have the correct information in hand.
I just want to piggyback off that too. I think everybody just wants to be safe and healthy, right?
Exactly.
And that's like a common seed that we can all share. And when people are sharing perhaps misinformation and know it or don't know it, it's about trying to whether that's themselves, whether that's loved ones. There's just different ways of thinking about it and different information they're being given. And so when I'm chatting with people, I always try, and that is a middle ground that we can always find. I am here vaccinating you today because I'm trying to keep you safe and healthy. I know that's what you want as well. And that's something that, you know, we share here. So I think that's a really important piece to keep in mind as well when we're chatting with people.
Yeah. So some people had some specific questions about using ultimatums in these discussions. You know, do I say that you aren't allowed to see my kids or aren't allowed to come to dinner if you're not vaccinated? Can you comment on, and the question was specifically about, is that ethical? Is that effective? I was wondering if one of you could comment on that.
You know, I'm just going to chime in and say I'm personally not someone who's responsive to ultimatums. Maybe there's some people for whom that works, okay? And if you're sure it will work on someone, maybe it would. But really, I think 99% of the time you avoid those. I'll say, you know, our society, you know, mandatory vaccination is not the norm. There's some discussions about that, but they're not the norm in our society. We want people to choose vaccine, you know, on their own. And so in the context of a relationship or a family dynamic, if our society doesn't have vaccine mandates, why should you place a mandate on somebody in your own family? It doesn't make a lot of sense. And so again, that's sort of that pre-conversation checklist I talk about. Check your ego at the door. Why is it that you feel like you have to give somebody an ultimatum?
Right.
So on the flip hand, I mean, incentives is another thing. Specifically, we had someone, it's an employer, talking about, is it effective to grant incentives for people to get the vaccine? Is there any research to suggest that that's an effective tool?
I think one of the things that's really important about incentives is it talks about it being the norm, right? I think most people want to fit in for the most part. And by incentivizing it, there shows some collective, right, of either you or your loved ones or whoever that makes that more desirable. I think the incentive is nice, but it talks more to wanting to be part of this culture of people that are doing something together.
And it depends who we're talking about, right? Like, I mean, let's face it, right now, one of the populations that we're going to have a hard time convincing get vaccinated are our young friends. I mean, our young students and college students that we hope they're going to come back, you know, in the fall, and we can be all back in the classrooms and so on. So when we think of it, incentive, it can be an incentive in terms of a qualitative aspects. Like, look, we are all going to be in the classroom if you're all vaccinated. You actually, you know, like to be able to go to bars. So that's the incentive. So incentive has to be also something that can be, you know, less tangible than what we may think about. And because I think we need to keep in mind that there's no one size fits all. So if you're talking to someone, again, are you talking to, you know, your old aunt that's scared of the side effect, or are you talking to your college student who actually doesn't even want to get the flu shot or any type of shot because they don't see the point, because they're invulnerable, right, at that age? So like when we talk to each of these people, the type of incentive we may talk about are different, you know, like the old aunt maybe, you know, then you can be with other vaccinated people and you can resume, you know, your reading group and so on, versus for the college student is going to be something else.
There's also something interesting happening where people, you know, we're about 4 months into a vaccination. People are sharing on social media their sticker, their card. That seems somewhat unusual in terms of, you know, it happens sometimes with flu shots, but maybe not as commonly as now. Do you think that has a positive effect when people choose to share? Or what do you think about that trend? Dominique, I saw you shaking your head no.
Yes, because I was quoted in the media recently. You know, I have, you know, like social norm. I think Tess and AJ have both talked about how we're social animals and we tend to do what other people around us tend to do because we like to belong and so on. The problem is it's an equity issue right now. That vaccine is not available to everyone. And some people may not be vaccinated for whatever reason, or may not be able to, or don't have access. So by actually putting that selfie, you may actually produce jealousy, anger, and it may backfire. And I think at this time we should be brought together and not actually brought apart. They say, oh, you're vaccinated, I'm not. Again, we get into the stripes now. Now we have the vaccinated people against the not vaccinated people. I'm not sure it's helping as a matter. If the vaccine was, super accessible to everyone, if everyone could just decide, hey, now I'm getting vaccinated, I'm going to go, then yes, but that's not the case. That's not how it is. Some part of the countries have it, or some population have it. So it feels like a privileged thing to be vaccinated, showing it off. No offense to everybody that's here with their selfies. I mean, I know you have. We try to do that because we think it's good to do it, but I'm not really convinced it's helping right now.
I think it's been so interesting to be here at Alliant Energy Center. The amount of people that want photos taken. Hey, nurse that's vaccinating me, can you stop what you're doing so that you can take a photo of me? It's been really interesting to see it play out, here at Alliant Energy Center. And I think we really saw some of that. I mean, really jealousy is kind of what it boiled down to. Supply was really limited, and we saw a lot of people posting photos and why did you get the vaccine, especially when we're in these phases where eligibility is based on employment or medical things, right? And I think that we're kind of in a culture here in the United States, of, what do you do for a living? But not everybody is proud of what they do for a living, and whatever made them eligible for vaccine, whether that's employment-wise or medically, might not be something that they want to share. So that's been, fascinating to watch happen here, and trying to be mindful of, also, I think social media has really connected us globally too. And the United States has been very fortunate in getting a lot of vaccine. Some of our partners and friends around us are not as, fortunate. And so I think with this globalization, but the race has not been equivalent with all these different countries, has been, even maybe more divisive in more ways, even just within our small community. Yes, also not trying to shame anybody because it is exciting and trying to get to this norm, but it also just creates, some wedges I've seen.
I just want to say that hearing Dominique and Tess express what they expressed, I hadn't thought about it as deeply as what they just said, and it makes sense, that you never want to be a show off, I guess you could say. But I can also see people having positive intentions for doing it, right? So
for sure.
Yeah, and so like if people around me were waving their vaccine cards, I would be fine with it. But hearing Dominique and hearing Tess, I now sort of have these mixed feelings where I can see how a lot of people will perceive that differently. And at the end of the day, posting something on social media for the World Wide Web to see, is it really about you or is it really about them? I think that maybe that's the question we ought to ask. Within your own family, friends, where it may be more appreciated and everybody's got this social contract to get vaccinated, when their turn comes up, it'll be perceived differently.
Yeah. And I also think that, we've talked a lot about how each of these conversations is very different. Every single one is different depending on who you're talking to, where they're coming from. So maybe for some people, knowing that you got a vaccine might be influential, and for others, maybe it would change. Each of these conversations is distinct and unique. Tess, I'm curious if, Wisconsin has been doing very well with distribution. And the governor just announced yesterday that as of April 5th, everybody 16 and older is eligible for a vaccine. Obviously, the availability might be limited for a while, but come April 5th, everyone's eligible. Have you seen that, given the fact that the rollout's happening fairly well in Wisconsin, have you seen people's concerns shift? The questions that you get, are they different now than they were early on?
I would say yes and no, in the sense that we are still, when we talk about tiers, even though they've kind of gone away as we've expanded really quickly, that we're still kind of in this tier 1B phase, because it's a huge group, right? So tier 1A and tier 1B combined in Wisconsin makes up about 50% of Wisconsin. So we're still, kind of trying to get through those numbers. And so the folks that we're still seeing here are still in that previously, or maybe two previously eligible group. And so a lot of the questions are starting to, I would say, shift more towards how can we make this more accessible to folks that can't get here, right? And we've been trying to do that this whole time, but because of supply being so limited initially, it made it really logistically challenging. We're trying to change our mindset in the sense of now we're at a place where we have a little bit of allocation that we can expect. How can we reach different communities with barriers and access issues differently? So we're starting to get more of those questions and trying to respond to those. I would also say we're starting to hear less and less of safety questions and more of how long is this vaccine going to last questions. And I think it's really nice to see more and more safety and efficacy data come out and roll out as time goes on, and hopefully just, bolsters people's confidence in the vaccine, but gets us into this unknown of we don't know how long the vaccine is effective for and those sorts of things, which makes, it feels like this whole thing has been uncharted territory, but just kind of keeps us on that trajectory.
Speaking of accessibility, if somebody has the question, they're not sure how to get the vaccine, they're confused about the process, obviously some people here are from Wisconsin, but people from all over are tuning in. Tess, would you recommend people reach out to their local public health authority? Are there particularly good resources for people to help? Are there resources for people to help navigate the sometimes complicated process?
Yeah, for sure. So I would say it's completely different in every jurisdiction, in terms of really who's doing the vaccinating, what kind of work is being done, what groups are currently eligible, but always has an idea of what's going on in the area. So they're always a great place to start. They usually have a pretty good pulse on what's happening in the area and is kind of, historically and right now, convener of resources and trying to make sure that everybody is at the same table. So definitely reach out to, your local public health if you're not even sure where to start, and hopefully they can direct you to the right place.
Okay. So we're winding down now. I was hoping that you could share, each one of you could share maybe some resources that people could look into if they want some more. I know we've mentioned some already, but is anything missing from the conversation that you want to add on that people can look into? Maybe start with Dominique.
Well, I think actually that for people that are from Madison, I think the Dane County and the Madison Public Health have done an excellent job. They actually, if you look at their social media page, they start with the concern of their resident and go for them. So I think that's a very good resources also to follow on social media, or the local public health departments that are putting out their very good information. So let's not discard everything that's on social media.
I'm going to put in a plug. I've done this once before, and I'm going to do it again for a group called Dear Pandemic, which has grown in popularity now and is over 150, 200,000 followers on Facebook and Twitter. Grown out of the UW-Madison with Dr. Malia Jones and her colleagues. They're self-described nerdy girls who translate science into practice and think about everyday issues. And I've relied on them as a resource to kind of really dissect hot topics.
I would say for me, a place I always go to CDC for sure, but I really like the Mayo Clinic. I think they break down some of those really common questions well and give the origin a little bit to where those concerns came from. I've seen some FAQs that don't quite get to the root of the problem, which I think is really important in having those conversations. So that's a resource that I really use in my practice.
And I do want to reiterate too, there is a resource for how to have these conversations if you're interested in learning more about that from the National Academies Press. And we're sharing the PDF in the Files tab, but you can also find that online. There's some online resources as well for how to go about doing that. And then I was hoping that you each could go through and talk about what brings you hope, knowing where we are right now and what makes you hopeful for the future. Maybe start with Ajay.
The fact that the vast majority of Americans want to get vaccinated gives me a lot of hope. And I think as more people get vaccinated, I have a feeling that number is going to continue to climb. And I'm appreciative of that. Also, the recent data of safety in children showing that the vaccine is safe in children, at least the Pfizer data has been sort of pre-released. In a sense, and I think that's also great. That maybe before school starts, a lot more people will be vaccinated, and that'll be great.
I'll go next. Something that really gives me hope is looking at our data. Some days are frustrating, as I'm sure all of you guys is as well. But every day I go home and I think, how many doses did we put in the arms today? And that's something that really, really keeps me going. And, when I look at Dane County data here, in, Madison, Wisconsin, 89% of those 65 and older have received at least one dose of vaccine. And those are incredible numbers to see. The numbers that I saw today is that 33% of Dane County residents have received at least one dose. So we're getting to a point where, we're starting to see the scales tip a little bit, which is giving me hope. And, having more conversations is giving me hope. Something that I really try to use in my practice is a quote that says, "Nothing about us without us is for us," which seems really what are those words? But I'll say it one more time. Nothing about us without us is for us. And if we don't have the right people at the table to have those conversations, then we shouldn't even be having the conversations. So really trying to talk with our communities more and more to see how we can better serve, people that might have been missed early in this. So that's.
And Dominique?
Yes, I will second everything Ajay and Tess have said, as far as the numbers give us hope. But also, what gives me hope is I feel like people are coming together. And we can really see that, the communities and members and everyone is willing to actually go post-pandemic in a world that would be a better place. And we're beginning to see the light out of the tunnel, and we can do this all together. And we are beginning to see the fruit of that approach, and that makes me a lot of hope.
Fantastic. So thank you all for joining us today. That's really all we have time for. We will be sending out a recording of this lecture with a recap and some of these links and PDFs available to you. You should see that in your inbox. We'll also put a message in the chat to sign up for our e-newsletter. You can find out more about our future webinars. Hopefully we will have some more about the pandemic. And that also, we're going to do we'll offer you a sticker as well. If anyone's interested in a mortgage sticker, we have a virology themed sticker that you can get. But thank you all so much for joining us today. I hope you learned something. I hope you are able to navigate those conversations a little bit better, and that you all get vaccinated soon if you want, and keep wearing those masks, keep washing those hands, and that we're on our way to the end of this pandemic. Thanks so much.
Thank you.
Thank you.